How's our patient this morning? Dr. Lang, I was the cardiologist on call when you came in.
See, what I need is a GI specialist. I don't mean to be rude, but what am I doing here? I feel perfectly well.
She doesn't remember a whole lot right now.
I'm not surprised. You were in and out for a while and sedated during the procedure.
Well, see, I'm sure you're really competent, okay? But the problem here is not my heart, it's my stomach. And I think I know my own body, okay? So please, when can I go home?
It won't be today, I'm afraid.
Why not?
Ms. Atkinson.
Not that name, please. Jill.
When you came in last night, your EKG showed that you were in the throes of myocardial infarction. You had a heart attack.
What? No, that can't be.
Doctor, can you explain it to her the way that you explained it to us, please?
You have heart disease, Jill. Plaque's been building up in the walls of your arteries for several years. The vessels get stiff after a while, and in your case, several of them ruptured. As your body attempted to repair the damage, clots formed. Your left anterior descending artery had just closed up with 100% blockage. You had another one that was blocked at 80%. Your heart muscle couldn't get enough oxygen. Now, I'm hopeful that eventually you'll be able to regain full function. You're lucky. This artery's been nicknamed the Widowmaker. It was a good thing your son and Esther brought you in when they did, or else this could have been fatal.
Oh my God.
You have a couple more arteries that are blocked at about 60%. We'll keep a close eye on them, but they weren't serious enough to stent.
Stent?
We placed 2 medicated stents inside your heart, 2 mesh tubings that opened up the arteries to keep the blood flowing.
Once she does come home, how do we treat this?
No. Stop this. This is ridiculous. You are making it sound like I'm at death's door. I had an incident because I lost all of my money. My stupid husband betrayed me. Anybody would feel sick after that.
Jill, come on, you can deny this all you want.
No, she can't, Esther. This is a wake-up call and she needs to listen.
Excuse me. I am right here in this room. Do not treat me like some frail old woman. I had a bad moment. It passed. I'm fine now, and I am going home.
Jill, calm down. Just breathe.
All right, get these things off me. I need to
Jill?
get dressed and go home.
Jill.
Anywhere.
No, the hell I'm not.
Stop being so stubborn.
Come on, Jill, let me help you get
Touch
back into
me,
this.
you are a dead woman, Esther. Stop it. You are all overreacting. Now, it's not like I had chest pains and keeled over.
I understand why you're having trouble accepting what happened. The women's symptoms are quite often very different than men's symptoms. Yesterday, when you came in, you were complaining about your jaw aching and you had shortness of breath.
She was nauseated, too.
And perspiring.
Oh, because you keep the heat on at full blast, Esther.
Believe it or not, these are typical coronary symptoms for women. Some have the kind of chest pains that men experience, but many more don't.
I thought it was acid reflux. I've been having that a lot.
Maybe it's been your heart all along.
It's a mistake that we see every single day. Symptoms can mimic each other. Digestive problems, panic attacks, stomach pains, chest pains, feeling like you're tired all the time. All these can be present with the heart issues. That's why it's crucial to get to a doctor right away and make sure that you know what's going on. Heart disease is the leading cause of death for women in this country. It's nothing to play around with.
Bottom line, though, Doc, she's going to be okay.
She'll be able to get back to her usual activities very soon, but with time and some lifestyle adjustments, she will probably be able to live a fairly normal life.
It's good to know.
Jill, have you had any other symptoms? Pain in your shoulder, arm, or back?
No pain anywhere.
And how's your stress level? Is it higher than usual? You're going to have to avoid that if you want to stay well. And what about family history? Is there anything else that I should be aware of?
Her father died of a massive heart attack.
And there could be history on her mother's side, too, but Jill doesn't really know that part of her family.
Yeah,
well.
Esther, you've done enough talking. Please, could you give me some coffee or something?
Oh, no. No coffee. How about soothing herbal tea?
Esther, whatever. Just go and get it, please.
If you ever have any symptoms like you did last night, I want you to call 911 immediately. Do not drive yourself. Do not call a taxi. Time is critical. EMTs can cut through traffic. They can start treatment in the ambulance. They can call ahead with your vital signs, and you can go to the head of the triage line. When you're having a stroke or a heart attack, minutes count.
That's good advice. Right, Mom? That's good advice. Thank you, Doctor.
You're welcome. Now, Jill, I have you booked today for an echocardiogram. It's going to be non-invasive. It'll take about an hour, and it should tell us how the stents are working. And in a few weeks, we'll get you on a treadmill and do a stress test.
No more tests. No, I've got too much to do. Billy, you know I have to call my banker right
There's
away.
No wheeling and dealing right now. You need to take care of yourself.
No.
Your son is
Billy.
right.
No, you can't force me to stay here. Neither one of you can force me. No, I have stuff to do, and I'm going to do it. Don't.
Doctor, please, can I just have a minute with her, please?
Yes.
I guess it's that time, isn't it?
It is.
What are you doing here?
What's going on here? Where are they taking you? I am so worried about you.
Sir, I am going to have to ask you to go into...
What?
You need
Baby,
to back
what?
up. Mom,
She's sedated. We found an anomaly on the echo.
that doesn't sound good.
One part of the cardiac wall wasn't functioning as well as it was post-stent angiogram. That means one of the stents may have become blocked. We needed to go in and replace it.
She's gonna be okay, all right? She's gonna make full recovery?
The procedure went very well. But if she does everything we ask, then she could have a full recovery, but we need to keep in mind the unhealthy lifestyle choices that led her to this problem and whether or not she is willing to make the necessary changes. She's going to need to start an exercise regime, change her diet.
Oh, no problem. That's my area of expertise. Only hearty, healthy meals from now on.
We'll start her on blood-thinning medication to make sure the stents stay open, and we'll send her to the cardiac rehab so that she can gain her strength back through exercise supervised by doctors and nurses. And it is important that she attends every session.
Oh, she will, even if I have to drag her there. What else can she do?
Well, we can keep her blood pressure low, reduce stress, and limit alcohol consumption.
Don't take it from me. Let's ask your doctor.
Ask me what?
Nothing, Dr. Lang.
Oh, really?
My son just adorably stopped by to fuss over me.
I told you that you were like a woman. Billy, if you'd excuse us, your mom and I need to perform a quick follow-up.
I'll be right outside. You listen to her.
Would you please tell my son and Esther that I had a routine procedure
Actually,
and I don't...
Jill, I need to explain a few things to you. Billy and Esther are right to be concerned. Your heart suffered significant damage, and it's not something you can ignore.
Okay. I'm listening. Just tell me what I have to do to get out of your hair and get on with my life.
I wish it were that simple. I'm talking about a lifestyle change.
What kind of a change?
Major. So, are you ready to accept that and the things that you need to do to stay healthy and alive?
Yeah.
Most of my
I'm ready.
patients discover they actually really like the Mediterranean diet.
She loves the Mediterranean, don't you?
I get it, Billy. Stand down.
Esther is already waist deep in the cookbooks, making sure that she has every healthy meal she could dream of.
Terrific. And I've enrolled you in cardiac rehab, a supervised exercise program in the hospital gym.
Personal training paid by the insurance? Sweet.
You're doing it again. So, please tell me what medications I'll be on.
3, a blood pressure medicine, a blood thinner, and
What's the thinner for?
keeping the stents open and making sure blood clots don't develop. And because of the plaque in her arteries, the 3rd prescription is a statin.
But if I'm on a diet and exercise routine, why do I need a statin?
It greatly reduces the risk of another heart attack by decreasing your cholesterol.
She'll take it.
Yes, thank you. And please excuse my son. He thinks he's the parent now.
Jill, you're very lucky you care so much. Sticking to a major lifestyle change is so much easier with family support.
I don't think it'll be too difficult. It sounds reasonable.
And you have to stop drinking.
You mean cut down?
I mean cut down to 0.
What about an occasional martini? You mean a glass of champagne every week? All right, bi-weekly? No, I happen to know that red wine is a staple of a balanced Mediterranean diet.
You're on a slightly modified plan. You cannot mix alcohol with these medications, I'm sorry.
Aren't you being overly cautious?
We have to be, and it's crucial you cut back on work. Right now, your number one danger is stress.
Great. Then don't ask me to bring back prohibition.
She's just venting, Dr. Lang. On top of that, Esther and I have already talked. We've cut away the stress at home.
What does that mean?
For now, just let Billy and Esther take care of you. If you follow this program, you'll recover and live a long, quality life.
She will follow it, trust me.
I will follow it. He'll make me. Thank you, Dr. Lang.